Today's program wouldn't be a program without our good friends over at Mosaic Life Care in St. Joseph, Missouri. They have been leading the way since their conception, bringing good health care to those around them in the area. And they bring also innovations. If you joined us a little bit earlier, you might have saw some of the innovations they're putting in radiology, ultrasound, and cancer treatment at Mosaic Life Care. But with us today, we have one of their healthcare heroes, Aileen Rost, who is in the radiology field at Mosaic Life Care. She was raised in Northeast Kansas. She graduated from Methodist Medical Center in St. Joseph, Missouri, and she started her healthcare career at St. Luke's Health System in Kansas City before transferring to Mosaic Life Care when she's been there for over 35 years, helping patients every day. Over the years, she has helped operate and open 3 imaging centers, oversaw multiple clinics and imaging, and has been a hospital manager. Mosaic was the first healthcare system in the region to become ACR accredited and started with calcium score and lens screen programs for the St. Joseph community and 16 surrounding counties, providing opportunities for Aileen to learn and grow in many avenues. Aileen is passionate about radiology field and all the healthcare careers it offers. Second only to nursing, radiology is the second highest number of available professions. With us today to talk a little bit about her pathway in healthcare career is Aileen Rost from Mosaic in St. Joseph. Aileen, thank you for joining us for Healthcare Career Day. Please share your story and inspire those that are joining us from all over the state and the country. Aileen, can you go ahead and unmute your volume there, your microphone? If you want to go ahead and try to unmute that microphone.
Okay, there we go.
Awesome.
I apologize.
No worries.
We
got it.
So, Brian, thank you for the opportunity. Radiology is definitely my passion, and so I enjoy sharing my story. When I was in high school, and some of you kids out there listening might be able to relate to this, I had an injury, and I went in to have some x-rays, and it was not the most pleasant interaction, just being honest. So I thought to myself, well, x-ray intrigues me. I kind of want to know how the inside of the body works, how it looks, and there's got to be a better way to treat people. So that was kind of my segue in, as I wanted to help people, maybe make things a little bit more pleasant for them. So I worked weekends in the x-ray department in my hometown, applied for a school about an hour away, and got into the school and really was diligent about my studies because I knew over the years I wanted to progress. And so that allowed me to work weekends in the emergency room in my second year of school. So there's a lot of opportunity, kids, for you to be able to segue in and work as a non-registered radiology tech. When I graduated, I moved to Kansas City, wanted to explore a bigger teaching hospital. And radiology has allowed me to enter into a couple different paths. It's kind of like a field that has different languages. We have CAT scan, X-ray, nuclear medicine, ultrasound, mammography, MRI, lots of opportunity for growth. And so I honestly took advantage of it, Brian. I enjoyed learning more and more. And I now hold a certification in CT and interventional radiology. And I just encourage you to, look at the opportunities that are out there in healthcare. Like Brian mentioned, radiology is the second largest medical field next to nursing. And we're very proud of that. We love interacting with people. We have a great family setting in our department, which makes it nice to come to work. We have very good benefits, and our pay scale is really competitive in the Kansas City market. We also have opportunity that we have partnered with some schools, and there are scholarships to help with the tuition cost. There are programs to help you once you're in a Mosaic to grow in your education with some tuition reimbursement. But I really, really encourage you to shadow go to a hospital that is close to you, shadow in radiology, see what it's all about. It's a phenomenal career. I would not change a thing that I've done, and it's afforded me a lot of opportunity, like I mentioned, to go into different areas and aspects of radiology and build relationships. And I am very, very proud and privileged to work for Mosaic. So, Brian, thanks for your time. I appreciate it.
Absolutely, Aileen. And I'm just kind of curious, working in your profession, you come across a lot of different people in a lot of different situations. What are some of the best parts of your job?
I would have to say the best part is those relationships that we build with our patients that unfortunately have to return to us for care, and also making a difference in, say, an emergency room situation where you have one opportunity to help diagnose someone that's possibly been in a car wreck, or just comforting a child that may have fallen and broken their arm. I've also been very privileged to work with the chiefs with their training center in St. Joseph. So that's kind of a very cool thing. But just building those relationships and having that interaction with patients to put them at ease and give them some peace that they are in good hands and that we will help them figure out what their issue might be, and provide quality imaging to the providers to help them heal or be taken care of.
Well, I know you piqued the interest of a lot of students today when you said that you help out the Kansas City Chiefs at their spring training program up there in St. Joseph, Missouri. So we couldn't have a winning team on the field without your help, and thank you for that. Any last words of inspiration you'd like to share with the students as they're watching today?
Explore on the internet. I know you guys are on your phones. Google radiology, look at some images, see what intrigues you. And then I really encourage you to talk to your counselors or someone at a hospital to see if there's opportunity to shadow and see what radiology is about. It's a great career with multiple opportunities for growth and a lot of learning, and the technology is phenomenal. As you probably saw on the video prior to this presentation, we have world-class scanners, and we invest a lot in our community, and we like to have our technologists close to home, because when you're vested and rooted there, you have a lot of passion to take care of the people in your community.
Well, thank you, Aileen, for coming in today, and thank you for all you do to help patients deal with some of the most challenging moments of their life and get through those moments, and hopefully on a better, healthier avenue after that way. And thank you to Mosaic Life for coming in live from St. Joseph, Missouri today. We're fortunate to have you as a partner. Thank you.